Hello everyone, welcome to BrainMindia. Today we are going to discuss about a psychiatric disease called functional psychosis. It's a very complex disease. In today's world, it is on the rise and we are listening about this disease a lot. So we have arranged discussion about functional psychosis. For this purpose, we have in our studio a famous doctor, Dr. Jakir Hossain Laskar. Welcome to our studio, doctor. Today's discussion will be all about functional psychosis. And my first question will be, what is functional psychosis?
Actually, functional, first of all, I should say that all types of psychiatric disorders, mental problems are on the rise, what you have just said regarding functional psychosis. So, this functional psychosis, it's a group of psychiatric disorders, which is characterized by disturbances in thought, disturbances in perception, disturbances in emotions, and also disturbances in various kinds of behavioral issues, and which significantly impair a person's ability to function in day-to-day life. Actually, we say that unlike other unlike other organic psychosis, which are caused by injuries of the brain or any kind of neurological diseases, these functional psychoses have no specific cause. It is said that a combination of genetic, environmental, and neurobiological factors may play a role to create this disease. And interestingly, two common types of functional psychosis are, one is schizophrenia and one is schizoaffective disorder.
So, we have just heard about functional psychosis. My next question will be, what is the symptoms of this disease? So that we can understand that a person is suffering from this kind of complex disease.
Actually, nowadays, many patients have been coming to our clinic with functional psychosis. Red line symptoms, keynote symptoms are hallucinations, delusions. Actually, patients perceiving things which are not present, and sometimes some patient experiences that they are hearing voices from long distance, or they are beholding anything which is not real. Sometimes delusions are common in functional psychosis. False beliefs. Against the contrary, false beliefs which are mostly persecutory in nature, these are caused. And besides, most important symptom of functional psychosis is disorganized thinking. Thought process of the patient is disorganized. They have difficulties organizing thoughts. They have difficulties expressing them coherently, and which leads to speech that becomes fragmented. Speech becomes fragmented. These are the keynote symptoms. Some negative symptoms also express in our clinics. A reduction and absence of normal emotional response is very common in functional psychosis, and behaviors as well, such as, if say, lack of motivation, social withdrawal, and diminished emotional expression. These are common in functional psychosis. Besides, some recently I have seen several patients who expressed cognitive impairments as well, such as difficulties in memories, difficulties in attention. I mean, span of attention is diminished, and patient cannot perform properly their executive functions. These are common, and eventually which impact the daily functioning and which hampers his independent living. These are common. Very recently, I have seen 2-3 patients who have experienced disrupted sleep patterns. They said that they are having insomnia, severe insomnia, irregular sleep-wake cycle. These are common in all kind of patients having functional psychosis.
Okay. So, it's a very serious disease, as
serious disease. And one point I should not skip, that is impaired social, I say impaired social and occupational functioning. I mean, they are having difficulties maintaining relationships, I mean social relations. They cannot hold his employment, and they do not able to participate in daily activities.
They cannot socialize
themselves. Yes. These are commons in functional psychosis.
Okay. So it's a very tough situation for the patients, those who are having this kind of disease. Now, my next question will be, what is the cause of this disease?
Actually, exact cause, exact etiology is unknown as of now, but functionally it is said that genetic predisposition, environmental some causes, and brain chemical neurobiological imbalance are combinedly responsible to create this disease, functional psychosis. Sometimes some risk factors are considered, which it is called genetic predisposition, which is called prenatal complications. For childbirth, there are some complications which may trigger functional psychosis. And one more important item is childhood trauma, early childhood trauma. Some people take substance which is alcohol, drugs. So substance abuse may be the risk factor of having functional psychosis. Besides, those who are going through very stressful situations in their lives, they may experience functional psychosis as well.
Okay, so causes are very common. People are being stressed in this world,
yes,
and they have the chance to get this kind of disease.
Yes, actually lifestyle modification can deter this disease, but people are so reluctant, so lackadaisical in this regard that they don't even consider that how they should behave throughout the day, how much sleep they required, what kind of food they should eat, because of lack of knowledge.
So we call it as a lifestyle disease?
To some extent, it is called lifestyle disease.
Okay, now,
but
as you are saying that
yes, having
consumption of alcohol is responsible also. Yes. So can we call it a lifestyle disease?
Lifestyle disease.
Okay.
Certainly.
It's a genetic disease. It can be a lifestyle disease. And there are some chances of prenatal injuries.
Yeah.
Okay. So as we know that this is a very critical disease, and obvious question will be, how can we manage this critical disease?
Yes, management without medication is important. I consider in every disease there are some management protocols. If it is practiced properly, patients can get benefited from management. In this regard, on functional psychosis, psychotherapy, especially supportive psychotherapy and cognitive behavior therapy, which is commonly called CBT, supportive therapy, family therapy, are evident to minimize the keynote symptoms of functional psychosis. Some psychosocial rehabilitation may help, cognitive remediation help, family education and support can help, and most importantly, exercise and physical activity. Those who do regular exercise and physical activity, they have experienced remarkable change in their symptoms, guiding symptoms. Nutritional support under the guidance of nutritional counselor and through dietetic interventions. If patients are given omega-3 fatty acid and these kind of brain supercharging elements, which are not medicines, which are supplements for food supplements, that also help well. Mindfulness practice, stress reduction techniques are also important. If it is given under the guidance of clinical psychologist or counseling psychotherapist, patient may improve without medicine within 2, 3, 4 months. Sometimes peer support groups are created, and they form structure, routine and environmental modifications, which are also very much helpful for patients, those who are suffering in functional psychosis.
Okay. So these are all part of management of the disease.
Yes.
And patient have to go to the clinician,
to the psychologist, to the therapist who can help overcome from these kind of symptoms, those who are suffering in functional psychosis.
Okay. Is there any treatment in
Yes.
homeopathy for this disease?
Certainly, there is a ray of hope. Homeopathy has very good treatment in functional psychosis. In short, I can say I have been practicing neuropsychiatry in India, in Kolkata for last 24 years, and I have seen several hundred patients. And as of now, very recently, so many people have come to my clinic and they are getting treated. From my vast experience, I can give some suggestion, the name of some medicines which can work very well in managing functional psychosis, in curing functional psychosis. One medicine is hyoscyamus niger. 10 potency of this medicine, if it is taken twice a week for 2 or 3 months, patients get relieved almost 70% symptoms. Besides, there is one more medicine, complementary medicine, Lachesis 200. If it has to be, Lachesis has to be taken 1 drop once a day before retiring, before going to bed for 2 months, and therapeutic dose helps manage acute symptoms. So there is a important medicine I get brilliant result named Lathyrus sativus mother tincture. Dose will be 20 drops twice a day with a little bit water, half cup of water, normal water. If it is given for 1 month, almost all kind of acute symptoms are relieved within a month. And I have seen that if treatment has continued for 4-5 months, then once again this Lathyrus sativus mother tincture is once again repeated. All other symptoms are relieved within 1 or 2 months. So totally 6 to 8 months of treatment may manage a severe case of functional psychosis through constitutional and therapeutic homeopathy.
Okay, one thing I want to ask you, that when a patient is diagnosed with functional psychosis, he or she will go for treatment and for management both the same at the same time,
yes.
or
Actually, either patient has gone to the clinician, psychologist, or patient has gone to the psychiatrist. Whoever it is, if patient goes to the psychologist, he or she will start his procedures, but besides, he will advise patients to take medication. Okay. And if patients come to psychiatrists, they start giving medicines according to their protocol. Besides, they encourage patients. I also encourage patients to take therapies, especially cognitive behavior therapy, supportive psychotherapy is very efficacious in managing within a short span of time those who are having functional psychosis.
well, you want to say that?
So parallelly, treatment and management
therapy
can go hand in hand.
Well, we have good news that there is a treatment for functional psychosis, and as we have just heard from Dr. Jakir Hossain Laskar, that in homeopathy there are very good medicines by which it can be cured, it can be managed properly. So that's all about functional psychosis. Hope you have learned a lot about functional psychosis, and I would request all of you, please share this video with all your friends so that many people can get the benefits of this video. That's all for now. See you in the next discussion.